Okay, hello students. First and foremost, I hope that all of you had a very good INICET. You can tell me how your exams went and if I'm audible before we start the recall for May 2024 session as far as forensic medicine and toxicology are concerned. So I hope I'm audible. Please let me know if I'm audible. If I'm audible, please let me know. Fantastic. So I'm going to start off. First of all, I hope that you guys had a good exam. Okay. And if you feel like, now when you're looking at all the recalls, some questions you may have answered incorrectly or anything like that, don't get disheartened. Okay. There's always going to be, tomorrow. So don't worry about it. Let's quickly get into it. Okay. So today we're going to be going through the INICET recall for May 2024 session. Now, as far as forensic medicine and toxicology was concerned, two things that you need to keep in mind, right? First thing is that almost everything that came up, I think there was 8 questions, 7 or 8, and all of them were covered. So that is the best part. We have covered it. If you went through all of the material that we had, then definitely 8 on 8 you would have definitely answered. It was quite an easy paper as far as forensic medicine was concerned, is what I'm hearing. So let's start off. The first thing is I want to put out a disclaimer saying that the questions here that I'm going to be discussing, they're based on recall, okay, and they might not be the exact same question. The few wordings here and there, few clinical scenarios up and down, but overall the gist of the question and the answer will be somewhat in the same realm. And also very important that once final questions as to what was actually asked in the exam reaches a consensus, we will update it in a timely manner. Okay, so that being said, let's continue with the first question. Now, the first question from what I was told is they gave you an image, right, of a skull, and there was a beveling that was seen, a beveling injury, which means an injury with a slope, as in there's an inner smaller area and outer larger area, or outer smaller area and inner larger area. Basically, there's a funneling. Okay, so over here they asked a very simple question, which is identify the source of the trauma in the image given below. So you look at the image, and if you guys remember, I gave a very specific case example itself. This is actually a picture from one of my own cases, and the image given in your INICET was very similar to this image, right? And the options given were scissor, rod, axe or hammer. I have heard both versions, and a bullet. It should be quite straightforward because this is from the ballistics case that I showed you, that the answer is bullet. Okay, so I'll just go through and show you what this is. I hope you guys remember this slide, right, from the ballistics chapter, traumatology 3, I think it was, where I went into depth about the mechanism of how beveled margins are formed in entry and exit wounds in gunshot injuries. Okay, so this is literally a slide from that same lecture. Okay, plus I gave you the case example. I hope that you remember this, of how there is beveling cut. You see how I've blown it up in one area to show you over here, right? How there is a beveling. There is a smaller outer and larger inner margin that you can clearly see. Okay. Again, pictures from the same case. I hope that if you were someone who has gone through it, that this was a very easy one to answer. Straightforward, you could have answered it, right? Next, just to do an overview to let you know where and all this was covered, we did cover it in Traumatology 3 Ballistics, the lecture notes of the very same video, and it was also included in the MCQs and explanations, and also in the image based class, right, that I had taken. The image based class, I hope that you remember. So these are all the images. I don't want you guys to get confused. I heard many students thinking it might be a scissor or it might be like a rod which might have been stabbed in the head. No, that the wound would have been completely different. And I think we have covered this. So I'll move on to the next question. The next question says, what is the antidote of cyanide poisoning? Okay, and the options they've given are amyl nitrate, sodium nitrate, sodium thiosulfate, benzyl thiocyanate, and sodium nitroprusside. Now the thing is, they'd only given 4 options, but the wrong option, they've given 2. I've heard 2 separate versions. Some people said benzyl thiocyanate and sodium nitroprusside. Both of these are not given in the treatment. And also some people said it's nitrate while actually the actual compound would be nitrite. Okay, so I've heard both versions, but just know that in this, the right answers would be you would need amyl nitrate. Yes, amyl nitrate is part of the treatment. Sodium nitrite, yes, it is definitely used in the treatment. Sodium thiosulfate, yes, also used in the treatment. Okay, so the right answer here would be A, B, and C. Okay, I hope that you guys are following so far. If there's any doubts, you can put it in the chat. If there's any confusion, if perhaps there was another option given or something different was given, you can please mention it in the chat box. Okay, now I hope you guys remember this slide. Okay, I hope you remember this slide. I very specifically talked about the Lilly cyanide antidote kit and what is the mechanism that happens, right? How initially there will be normal hemoglobin and you will give nitrites, which causes methemoglobinemia. Then that hemoglobin will react with cyanide to give you cyan meth hemoglobin. Then this will be insoluble. So therefore you have to give sodium thiosulfate to make it soluble so that it can be excreted out. Okay, I hope you remember this. This was covered in class. Okay, so again, where and all this was covered, we can quickly just go through. I had covered this in the lecture videos, specifically the asphyxiant cyanide part. The lecture notes of the same video also contain the very same information. The MCQs and explanations. Okay, also again the same question was asked or similar question was asked, and this was also asked in the previous year questions. So this was one of the questions that you must have at least experienced if you had gone through the previous year's papers. Okay, so this question has been asked before, so it was expected that they would ask something surrounding the same topic. I hope that once that you've gone through all of this, this doesn't seem like you've been caught off guard or anything like that. I hope that we can move on. Okay, I see that there are quite a few people in the chat. Yes, I see Dr. Vinay, Dr. Wonder Gape, I think it is, Dr. Devik Shetty, Abhirami as well. Yes, it's very nice to meet all of you. I'm glad you guys are watching. It's been an interesting few days to see all our students write their INICET and do so well. It's been heartwarming to hear all the responses. Many students have messaged and they've told us that they've been having a lot of success, and few one or two questions were confusing apparently, but overall many students said it's a very easy paper. So I am very confident you guys would have done a great job. Okay, so let's discuss the next question. Okay, so here question number 3 was match the following, and they've given you sexual paraphilias, right? And here let's go through them one by one. The first one says eonism. Now, eonism, we also talked about, it's called transvestism, where someone wears the clothes of the opposite gender. Okay. Then we have necrophilia. The word necro and philia is in there. So you already know what the actual term means. It means intercourse with a dead body or a cadaver. Then there's frotteurism, right? This I told you about, which is rubbing your genitals or your body parts against an unsuspecting individual, right? Is usually called frotteurism. It's also called touchism. Then there comes exhibitionism, right? Which is nothing but exposure of your genitals to an unsuspecting person. Then lastly, there's passive algolagnia. Some students said it's active algolagnia, but whatever it is, excuse me, whatever it is, either words, the phrase algolagnia is there, which means that there is something to do with pain. Okay. And since that has been taken into account, I have just directly put them one after the other. Eonism connects to this, necrophilia connects to this, frotteurism to this, exhibition and algolagnia. Okay, so passive algolagnia would be masochism, right? And your active algolagnia would be sadism. This was covered in class. I'll just quickly show you the slides after this, which will let you know that this was already covered, and just as a quick reminder of what things could be asked in the coming exams, because usually they tend to ask things which are somewhat related to the same topic. So we'll make sure that we quickly just touch upon that. Now, you might remember these slides from the class, right? Where we talked about what necrophilia was what necrophagia was, along with the punishment sections, right? So necrophilia here being love with a cadaver, okay, or having intercourse with a cadaver. Then we dealt with sexual perversions, paraphilic disorders, specifically frotteurism, right, which is rubbing of private parts of the victim hands with one's own genitalia, right? Usually occurs in crowded places like trains and buses. Section 290 or 291 of the IPC. This is another thing students were asking whether they should learn about the BNS system or the IPC system. I think you don't need to worry. As you can see, they have tried to avoid questions regarding this because BNS will only be in effect as of July 1st, as per the most recent gazette. Okay, so don't worry about that. Let's move on. Then we talked about transvestism or eonism, okay, which is gratification by wearing dress of the opposite sex, mostly seen in males, named after Chevalier Dion, right? And there is no punishment for this per se, okay? It is just the act of wearing the clothes of the opposite gender, okay? So this was also covered in class, okay? This is also covered in your notes. Whereas exhibitionism, yes, arousing by exposing one's genitals to unsuspecting persons. Yes, this was also covered. Flashing would be momentary exposure. Streaking would be running naked in public place. Mooning would be exposing your buttocks by bending over and lowering pants. Section 294 of the IPC gives you 3 months imprisonment as the punishment. Okay, so please keep these things in mind because this might be how they remodel the question to ask you in your upcoming exams. Now, another thing that is very important is you need to go through the notes. Okay, don't just watch the lectures and assume that you will have all the information. The MCQs and the lecture notes are also very important. Okay, I hope you remember this image. I had very specifically said that this was an image that I got online, right, which talks about exhibitionism, and this is also a form of flashing actually. Okay, so I hope this image at least came into your mind when the word exhibition was or exhibitionism was brought up in the question. And the reason why I specified notes is because this is very important, right? So this is what basically they asked from. So if you look at this over here, right, you look at sadism, masochism, there's algolagnia and passive algolagnia. So all of these things were more or less covered. And this table, right, may be the topic from which they select in your upcoming exams. So make sure you go through all of this because these synonym areas is where most people make mistakes in forensic medicine. There's a lot of synonyms and there's a lot of things which are eponyms as well, which is subject or topics which are named after specific individuals. So this may also come up. Okay, so now where was this covered? We covered this in the lecture video, Sexual Jurisprudence 1. The lecture notes of that very same video, MCQs and explanations, we had the same thing, and also previous year questions. Something regarding sexual paraphilias has been asked in almost every single exam up until now. It's a very easy way to get the student to score 1 mark, right? And therefore you shouldn't miss out. Okay, so please make sure you revise this. Okay, next question. Excuse me. This is the next question. The next question says, which of the following is not associated? Is not associated. Very important. They've negated with Korsakoff's psychosis. Is it confabulation? Is it polyneuropathy? Is it amnesia? Is it ophthalmoplegia? What do you guys think? Now, if you were someone who paid attention in class, you would know that I gave you guys a mnemonic, which was COTRAC. Right? I gave you this COTRAC mnemonic. The C is for confusion. The O for ophthalmoplegia. Okay. The A for ataxia. And the T for thiamine deficiency. Okay. I hope you guys are following. The C for confusion, O for ophthalmoplegia, A for ataxia, and T for thiamine deficiency. The R in the COTRAC part, right? The R is for retrograde amnesia. A for anterograde amnesia. Okay. The C is for confabulation. and this K is for Korsakoff's psychosis. So, what is not associated? See, there is amnesia, right? We know that in Korsakoff's psychosis, there is amnesia, right? There is confabulation, yes. Also, there is going to be polyneuropathy. Okay, so what is the one thing that is not there? You have ophthalmoplegia. That comes in your thiamine deficiency. Okay, so that doesn't come in it doesn't come in Korsakoff, it comes under Wernicke's, right? So that will come under Wernicke's. So do not forget this. Wernicke's applies to coat, Korsakoff psychosis occurs to rack. Okay, so the answer here is ophthalmoplegia. Okay, I hope that you guys have followed. Again, please soak this in. I have covered this very same mnemonic in class also. Okay, I have made sure that, and there's a fun fact also that I will share with you, but you must know this. Please drill this in, because a question regarding alcohol withdrawal, Korsakoff psychosis, or Wernicke's encephalopathy has been asked repeatedly in all your entrance exams. So this almost seems like a straight shot question that they will ask regarding forensic medicine. So please make sure that you go through this. Okay. So the answer here would be ophthalmoplegia. I hope that you guys are following so far. We'll move on, and I want to show you something very interesting and um, uh, very incidental, right? Which is that I don't know if you guys know this, but thumbnail of the video, the thumbnail of the video, the lecture video itself has me talking about the very same thing. Do you see it here? The thumbnail of our video itself has me giving the mnemonic. That is, please make sure. Okay, now there is no excuse only. Okay, so this has definitely been covered in class. There is no question. You see over here, confusion of everything, whatever I have told you, it is there. Okay, now many students are asking, what is confabulation? Okay, confabulation is nothing but someone who makes up parts of the story to fit in areas of missing memory. Okay, so person may remember, for example, right, this is a very crude example, but person may remember few things like what they were doing before they sat down and after they sat down, but they don't remember what they were doing while they were sitting down. So they make up that part. Okay, so it is fixing the gaps with stuff from their imagination. Basically, this person is trying to make sure that there is a coherent story. Sometimes it doesn't make sense, sometimes it does, but that is what confabulation stands for in this situation. Okay, so let's go on. Next one. Okay, so again, where was all of this covered? This was covered in your lecture videos under CNS depressants 1. We just saw the thumbnail. It was covered under lecture notes of the same video, right? The MCQs and explanations as well covered the same thing. Definitely, I've asked the question about the same thing, and it's a previously asked question. Yes, this topic seems to be recurring. Okay, so there is no excuse that you have. Moving forward, you must make sure that you cover at least Korsakoff's psychosis and Wernicke's encephalopathy and alcohol withdrawal, including delirium tremens. Okay, so this was also covered in the prepathon that we did. Okay, moving on. Next question. Question 5. Declaration of Oslo by World Medical Association in 1970 refers to what? Now, does it apply to therapeutic abortions? Does it apply to torture, degradation, cruel treatment of prisoners, ethical aspects for medical research, or hunger? Now, I have given a very specific table about this in the class, and it's also there in the notes. Therapeutic abortion, there are two O's, right? Also, it is obstetric. So, Oslo comes under this. Okay. Torture, degradation, or cruel punishment, right, to prisoners. When defining torture, I did mention that there is something called the Tokyo. Okay. Here you can remember torture, T and T. Okay. T and T. Then we have ethical aspects for medical research, right? This is the Helsinki. Okay. Helsinki Declaration. And lastly, we have the hunger one, which I told you is because of the migrants, right? There was a migrant strike in Malta and they were going on a hunger strike. So, can you force feed those who are on hunger strike? Was the main question that was discussed. And the World Medical Association came up with the declaration that since they are protesting, you cannot force feed them. So, this is the declaration of Malta, right? Malta has to do with hunger and migrants. Okay, so this I hope you guys remember, because this very same table that I'll be showing in the next slide, right? You'll see this table, and I hope you're able to recollect. See how I have given you all the important declarations, right? So just go through them one by one. You have the Geneva one, which talks about the response to Nazi Germany, which is a revision of the Hippocratic Oath. You have the Helsinki one, right? This was one of the options. The Tokyo one, this was also one of the options. Oslo, yes, this was the correct answer. I hope you remember this. Malta was also there. Hunger strikes forbids doctors from resuscitating. Ottawa, right, to emphasize the importance of child health. Okay, Ottawa. Now, I gave you a memory device also for the same thing. I hope you guys remember this, but declaration and the letter with which it starts and what it applies to. So over here, Geneva, right? You apply it here, G to G, which is German Nazi era. You have Helsinki, H, which is for human experimentations. You have T for torture and Tokyo, O for obstetric therapeutic abortions, M for migrants and hunger strikes, and Ottawa, O for orphans, which is the child health. Okay, so this covers this question as well. This was also dealt with in class. I hope that those of you who paid attention were able to get this right. Okay, but most of this was already covered in the video lecture of Medical Law and Ethics, Part 1. The lecture notes of the same video with the mnemonic also was given, and MCQ was also given regarding the same thing. Okay, I think it was given in the form of match the followings. So you would have easily answered it if you have gone through it. Okay, so next. So this is the question which is little bit in doubt, because many students are saying that the image that was provided is different, it's this, it's that. Whatever the issue may be, right? Question remains, patient presents with urinary crystals as shown in image. This is due to which poison? Okay, they've given options of ethylene glycol, methyl alcohol, aconite, OP poisoning. Now I can tell you right now that aconite and OP poisoning do not give you crystals, right? Methyl alcohol is possible. Yes, it is possible that it can give crystals, but it doesn't cause any sort of crystals that would be of a specific shape, right? So here we need to talk about ethylene glycol. The right answer is ethylene glycol. Here you will get either, I'll just blow this up so you can see, right? You'll either get calcium oxalate monohydrate crystals or dihydratic crystals. Okay, now notice over here the monohydrate crystals are shaped like this, right? They're shaped almost like dumbbells. Okay, so these are called dumbbell shaped crystals. Okay, or bilobed. See, it's shaped like a bilobed. Whereas when you're talking about the dihydratic crystals, it looks like an envelope, right? It looks like an envelope. So this has also been covered. This was a previously asked question. Okay, and so therefore I know for sure that we have covered it in the prepathon. Now I'll just back up a little bit so that you can see again. I have put a small disclaimer here, okay, which is that this question is not confirmed. Some students are saying that the image shown showed a coffin lid. If you had coffin lid crystals, then we're talking about struvite, and that happens with urease splitting enzymes. So usually if you have like protease and klebsiella, it goes into surgery and microbiome more than it does with forensic medicine. But if it has to do anything with crystals, the answer would be ethylene glycol. However, this has been asked before, so there is no excuse for you not knowing urinary crystals. So make sure that you have at least you make a note to go over it next time, so you don't get caught off guard. So this same question was asked in INICET July 2021. This was one of the questions, and so it says true about urinary crystals as shown in image R, right? And so this is a previously asked question. There is no excuse. You should have definitely seen this one coming. Okay, and see this one they've given the envelope one, so you know that it is which one? It is bihydrate or dihydratic crystals. Okay, now this same thing explanation, yes, I have given it. See this calcium oxalate crystals. If they're monohydratic, you will get the envelope. Monohydratic, you will get the dumbbells. Dihydratic, you will get envelope, right? Uric acid crystals look like this. They're spindle shaped-ish, and you'll see they're almost rhomboid like. Then you get struvite crystals, which are coffin lid shaped, and you get cysteine, which are hexagonal. Okay, and this very same thing, I hope you guys remember, right? We had covered in the prepathon. I hope you guys are able to recollect. I have a direct screen cap from that class of me discussing this very same question. So, if nothing, then even if you haven't gone through the previous year questions, if you're at least attended the prepathon, you would have definitely known that something regarding urinary crystals would have definitely come. Okay, so I've shown that here this very same discussion of how to approach the various crystals was discussed. Okay, so just have a look over here. We discussed this in the prepathon. I hope I hope you're able to see it. We went through the exact same thing. Okay, cool. Now let's talk about the next question. Now this question caused a lot of confusion for students because they were in doubt. There were two options which seemed very similar and quite right. So I can understand the confusion that the students had. Right? The first one says during fetal autopsy, let's just go through the question first, which says during fetal autopsy, what is the order of examination to differentiate between live birth and stillbirth? Now, see, the question is phrased very importantly. What is the order of examination to differentiate between live birth and stillbirth? Now, in fetal autopsy, right? What is the first cavity to open? See, there are three cavities that we have. Which is the first cavity you must open? The first cavity is always going to be the cranial cavity. Okay, followed by what? You're going to open up the abdomen. Okay, followed by what? You're going to open up the thorax. Now, many students got confused because they thought the abdomen should be the first thing that is opened up. Now, I can understand why this confusion exists because the question is a little ambiguous. And so, certain people have just read lecture notes and they've not watched the videos. Or maybe I cannot speak for other people's videos, but they have said that you should open the abdomen first, right? And the question here says differentiate between live birth and stillbirth. Yes, when you're trying to differentiate between live birth and stillbirth, you should open the abdomen first before the thorax. Okay, but still you will be opening the cranial cavity first. So the confusion many students were having was, is it A or is it C? They knew that B was wrong. They knew that D was wrong. Students were confused whether it is A or C. Now, understand that you will always open the cranial cavity first when it is a fetus. The reason being, if there's not enough development or if there's not proper neurological development, then the child's compatibility to viability or compatibility to life would have been low. So you're always going to check to see that first, to see if the baby had any chance of surviving to begin with, right? So cranial cavity is usually the first one we open to check for any sort of malformations, deformations, or congenital abnormalities before we check for abdomen. The abdomen will check to see the diaphragm level. Okay, to see if there has been expansion of the lungs pushing the diaphragm down, or if it's very high resting. If it's resting in a higher position, that lets us know that respiration has not taken place, which tells us that it's a stillbirth. If it is a bit lower down, right, specific level of the ribs, right, below 5, then we will say that yes, this is most likely going to be a case of a live birth, which was then, either killed or passed away because of some other reason. Okay, so I understand there was a lot of confusion regarding this. This is why I've kept it towards the end. But yeah, the right answer here would be C. Okay, and this was covered in the lecture notes of autopsy and sexual jurisprudence 4. Okay, it is not gone too much into depth in the video lectures, but it's there in the lecture notes. I have made sure to cover it, along with how to open the cranial cavity is also mentioned. This last question, lot of students had many doubts. Many students got very confused. Let me just tell you, if you had known how to approach this, then you could have used the exclusion method. Sorry, I'll just do that correctly. The exclusion method. And exclusion method is something that I spoke about when we were talking about the prepathon. And I was telling you that you should go from what you know rather than worrying about what you don't know. Okay, so I'll give you an example. We'll read this question and I'll discuss this. The question says, this is question 8, says a 40-year-old female consumed a white colored rodenticide powder. Immediately it says something which will grab your attention. White colored rodenticide powder and presents with potassium level of 2.5 milliequivalents per liter. On examination, she has irregular pulse, okay, irregular pulse, muscle paralysis, and ECG shows multiple ventricular ectopic beats. What is the suspected poison? Now, anyone who has read through agricultural poisons is going to immediately feel like, yes, it's probably one of the phosphides. Okay, I think zinc phosphide, I've mentioned the option twice. Just don't consider this for a second. Let's look at the other options before we get to whatever, right? I think one of the other poisons was, if I'm not mistaken, they've given it as zinc carbonate, was it? Oh, warfarin toxicity was given. Sorry, huh? Warfarin. Okay. Okay. So option D was given as warfarin toxicity. Now let's go through all of these options, right? First and foremost, if warfarin was given to an individual, would they not mention the PT-INR? It's not mentioned. So that immediately discounts warfarin as an option. Nothing regarding coagulation is given, so warfarin is immediately removed. Okay, even though warfarin can be a part of a lot of the rodenticides, here because PT-INR, nothing about coagulation is given, we know it's the wrong answer. Okay, then you have zinc phosphide, aluminum phosphide. Both of these work the very same way. I hope that you remember. I talked about it. I hope you remember how once it comes into contact with the stomach fluids, specifically HCl, phosphine gas is liberated, right? And this phosphine gas directly acts on the electron transport chain by inhibiting cytochrome oxidase, and that is what causes ventricular tachycardia and arrhythmias and ECG abnormalities. It's a mitochondrial poison. I very clearly mentioned this, and I hope that you guys remember this because I didn't mention anywhere that it causes any sort of electrolyte disturbance. Okay, so immediately that removes zinc phosphide and aluminum phosphide as options, which leaves you only one option, which is barium carbonate. So the right option here is barium carbonate. I have said this before, but when you don't know something, right, when you don't know the answer immediately, don't give up. Go through it, see if there is some way you can figure it out, because sometimes they want to see if you know from not just from A to B, but if you know from B to A also. Okay, so that will require you to just go through all the options and see and remember and trust what you have studied. Okay, so that's very important. Okay, now this question is tricky. Again, what I explained, I've just put it in text format, right? When aluminum phosphide and zinc phosphide, they seem like good options. I'm not saying no, because rodenticide is given, they mentioned ECG abnormalities. It seems like a good option. Not going to say no. Okay, but neither of these two compounds will cause hypokalemia, right? And this hypokalemia is the thing which is eliciting the arrhythmia. They are, which is zinc phosphide and aluminum phosphide, they are ETC poisons via inhibition of cytochrome oxidase enzyme. They generate phosphine gas. Okay, and warfarin would have deranged the PT-INR. So that only leaves one option, that is barium carbonate. Okay, so that is the thing that you need to keep in mind. Now, where was this covered? In the video lecture of agricultural poisons, I talk about the mechanism of action, right, regarding your aluminum phosphide and zinc phosphide. There are lecture notes which cover the very same thing, and also very importantly, this was a previously asked question. It was asked many years ago, but a very similar question was asked regarding rodenticides and barium carbonate poisoning. Okay, so that I think covers most of it. That brings us to the end of the session. I have covered all of the questions that were asked regarding forensic medicine. We have done a great job from Manipal's side, at least. We have covered everything that could have been asked one way or another. You guys had all of the information, at least to the, if you talk about your video lectures, your lecture notes, your MCQs, previously asked questions, prepathons, we have covered everything. I think the entire team has done a great job, and I hope that you guys as well have, gleaned the greatest benefits and managed to secure yourself a very good score and a very good rank. And if you have not, don't worry, don't get disheartened. This is not the end. There's always going to be another attempt. You're always going to have a tomorrow. This is not the end of it, right? You can always do better, and you will definitely do better, because we will all, try and help you the best that we can. So from Manipal's side, we wish you the best of luck, and we're so glad to have helped you along this journey. And we still have upcoming exams to worry about. So make sure that you still stay tuned. I think after me, there's going to be another person who's going to be covering. So please make sure you pay attention and you follow through. Thank you so much for your time. Good evening, and I hope that this has been helpful. Thank you. This is Dr. Aditya. I'm signing off. Best of luck.